All right, good morning. It's so great to have you here this morning. I'm Tanna Clews, CEO of the New Hampshire Women's Foundation, and this is our fall press conference to release our Status of Women report. So if you've joined the wrong press conference, you might need to go to the next door room. Otherwise, we're so thrilled to have you here today. As you may know, the Women's Foundation invests in opportunity and equality for women and girls in the Granite State through research, education, advocacy, and grant making. We believe that accurate and comprehensive data must be the foundation for policies and laws that will most impact Granite State women and girls. In addition, education, policy, community, business, and nonprofit leaders need this accurate data to understand the changing demographics of their constituents and the challenges and opportunities that persist for women and girls and marginalized genders in New Hampshire. For these reasons, the New Hampshire Women's Foundation is committed to being a trusted source of data-driven research on women and girls. Today, we'll have a few speakers and we'll have the opportunity for you to ask questions at the end, and I will introduce each speaker before they speak. The New Hampshire Women's Foundation is pleased to release its flagship publication, The Status of Women in New Hampshire 2023. This report is the most comprehensive compilation of data on women in the Granite State. This biannual report is complemented by our other biannual sister report, The Status of Girls in New Hampshire. And you can find our last Status of Girls, as well as our last Status of Women reports on our website, nhwomensfoundation.org. The Status of Women report is the only place you can find, in one place, data about New Hampshire women from the most current and reliable sources. To start off our short speaking program, I'd like to introduce our chair of the board of New Hampshire Women's Foundation, Linda Johnson.
Thank you, Tanna, and good morning to everyone, and thanks for those of you who are able to join our call. The Board of Directors of the New Hampshire Women's Foundation is proud today to be presenting the Status of Women in New Hampshire. The organizations that merged to create the New Hampshire Women's Foundation has a rich history of research. Today, we build on that foundation by adding the latest edition of the Status of Women in New Hampshire to our research portfolio. The board recognizes that data-driven research is essential to the work of our fellow nonprofits, policymakers, advocates, community leaders, and the public. We invested in this research because if the public discourse about issues affecting women is based in data, we will achieve better outcomes and move toward a more equitable future for all Granite Staters.
Thanks, Linda. Next, you'll hear from Devan Quinn, our Director of Policy, Kristin Smith, one of our lead researchers, and Paula Ferenc, one of our grantees, about the findings and impact of this report. Devan Quinn, as I mentioned, is the Director of Policy here at the New Hampshire Women's Foundation. Kristin Smith is the Visiting Research Associate Professor of Sociology at Dartmouth College and a good friend to the Women's Foundation. And Paula Ferenc is the Executive Director of Belknap House, which is one of our most loved grantees here at the Women's Foundation and featured in this year's report. Devan?
All right, we have a few slides for you to show you some of the highlights of the report and give you a sense of what this report is all about. So if you go to the next slide, here is the cover of the Status of Women in New Hampshire 2023. And if you go to the next slide, this report includes 85 indicators of New Hampshire women's well-being in the areas of demographics, COVID-19, health, safety, economic security, and leadership. The data in this report highlight a hardworking, resilient, and diversifying population of women. However, the data also enumerate many social, economic, and political barriers facing women and compounding inequities by race, ethnicity, geography, age, and parenting status. These barriers and inequities present opportunities for New Hampshire to invest in women for a more vibrant and prosperous future. We wanted to provide a few contextual points about the data in this report. So if you go to the next slide. The data in this report are from the most recently available date prior to publication, so usually between 2020 and 2022. Consequently, this report does not fully capture the entire effects of COVID-19 on women in New Hampshire, but as we continue to release the Status of Women and Status of Girls reports, we will continue to see the impacts of the pandemic as time goes on. The data is collected from a variety of sources, including the US Census and other state and national sources. Our reporting is limited to the data collected by our sources, and while the New Hampshire Women's Foundation recognizes and values gender expansive identities and inclusive and self-determining race and ethnic identity, we're often not able to report more inclusive data due to data collection practices at the state and national level. We prioritize intersectionality in data whenever possible. The design of the report is intended to ensure that the research and data is accessible for any and all audiences, from subject matter experts to policymakers to middle school students. And finally, the program spotlights. This report also includes program spotlights on organizations and programs doing work across the state to support, engage, and empower New Hampshire women. While we see some positive and negative impacts for women in the data of this report, we want to remind readers of the impact and influence positive community programming has and can continue to make in women's lives. Later, you'll hear from Paula from Belknap House, one of our program spotlights. And the next slide, please. We're going to go through the highlights of this report. And the first highlight is economic disparity. The gender wage gap persists in New Hampshire, with women making 76 cents to every dollar a man earns. But there are further disparities by race, ethnicity, geography, age, and parenting status. Next slide, please. For New Hampshire women of color, the gender wage gap widens. White non-Hispanic women make 80 cents for every dollar a white non-Hispanic man earns. Multiracial women earn 76 cents for every dollar a white non-Hispanic man earns. Asian women, 75 cents. Black or African American women and Hispanic or Latina women, 63 cents for every dollar a white non-Hispanic man earns. Next slide, please. The gender wage gap also widens by parenting status. Women with children in the house make 67 cents for every dollar a man makes, while women without children in the house make 85 cents to every dollar a man makes. This is also called the motherhood wage penalty. Next slide, please. The next highlight of the report is childcare and employment. Childcare is unaffordable and would cost on average 55% of the median income of a single mother of one infant. We can see that married couples in orange who have higher median incomes are paying around 10% of their income on childcare for one child. But for single mothers in pink, whose median income is much lower, childcare for just one child would cost more than half of that income. We know that childcare demands and responsibilities at home during the pandemic had a disproportionately negative effect on women's ability to stay in the workforce compared to men. Next slide, please. Women represented a majority of unemployment claims during the pandemic. So we're seeing how the pandemic and childcare costs have had and continue to have huge impacts on women's labor force participation and economic security. Next slide. In June of this past year, 2022, the US Supreme Court eliminated the federal right to abortion, leaving abortion rights up to the states. State abortion laws can restrict or support access and vary greatly state to state. Notably, New Hampshire is the only state in New England that has not protected the right to abortion in state law. Next slide. Abortion access is an indicator of women's health and well-being, and New Hampshire lags behind other New England states in protecting access. Next slide. Finally, our final highlight of this report is on women's representation. Women's representation has not yet quite reached parity in the judiciary, state house, or in municipal government. Next slide, please. I'm sorry, the previous slide. Only 38% of judges in state courts are women, with only one judge, a woman, who is a person of color. Next slide. Among town and city elected officials, women are making a big impact as a majority of school board members, but women lack representation in city councils and select boards, and only 2 mayors in New Hampshire are women, which is 15%. After the 2022 election, the Executive Council will be 40% women, the New Hampshire State House will be 37% women, and the New Hampshire Senate will be 50% women. The New Hampshire Senate has achieved parity once before after the 2008 elections, where there are 13 women senators, or 54%. We know that women, regardless of party, are more likely to seek compromise and more likely to support policies that assist women and girls in their community. We also know that women are just as likely to win as men, but we need more women from all parties to run. There are so many other compelling data points in this report, from mental health to homelessness to women CEOs, and we are thrilled that policymakers, nonprofits, community leaders, and the public will have access to this data.
Thank you, Devan. Kristin?
Thank you so much for inviting me to join this media alert. I'd like to expand on some of the highlights Devan just mentioned by talking about specific trends I'm seeing, particularly how the pandemic has impacted women's labor force participation. So as we all have witnessed and heard reported in the news, the pandemic has been hard on women and particularly on mothers. Childcare closures, school disruptions highlighted the gendered division of labor in the home and women's continued primary role as caretaker for children and family members. It was no surprise that women left the labor force en masse in September 2020, and that mothers' work hours have decreased over the pandemic. Clearly, women's progress in New Hampshire has been stymied by the pandemic, and the full effect of the pandemic is still unfolding. We can see this across many dimensions in this report. So women's unemployment claims continue to be elevated compared to pre-pandemic levels. As Devan just mentioned, women experience more anxiety and depression than men over the pandemic, and crisis centers are receiving more calls and providing shelter to more individuals who are staying in shelter longer. These are all serious implications of the pandemic that we as a state need to address. The high cost of childcare, coupled with the large number of childcare center closures, means that families are in a bind when it comes to finding affordable childcare. Next slide, please. Oh, actually, you switched it. You're in the right spot. The high cost, in fact, the Pulse survey shows that 43% of households with children in New Hampshire experienced childcare disruptions between December of 2021 and the end of February 2022. This is nearly 2 years into the pandemic, and we're still seeing childcare disruptions. So vulnerable families, those with lower incomes, rural families, families of color, all have experienced the effects of the pandemic to a greater extent. With higher initial unemployment levels, initial unemployment in April 2020, these groups have also recovered jobs more slowly. Women's employment levels have not yet returned to pre-pandemic levels. And next slide, please. Finally, I would be remiss if I neglected to mention that New Hampshire is not faring well compared to the other New England states in regards to paid family and medical leave and sick leave. Here we can see that New Hampshire is the only state that is gray, which is the states with no paid family medical or sick leave policies. Sorry. So workplace policies and protections are needed to facilitate women's returns to the workplace, such as accessible and affordable childcare, paid family and medical sick leave, flexible schedules and work hours, and policies to prevent pregnancy discrimination. And all of this is well documented in this report. Thank you.
Thanks, Kristin. Paula?
Thank you. It's a pleasure to be here today. I'm very grateful to have this opportunity to share on behalf of Belknap House. Belknap House provides families in Belknap County a safe shelter and empowers families to become self-sufficient and independent by providing opportunities and education. We work with clients to break cycles of poverty and cycles of abuse, to support and uplift them and to have them move forward with more courage, strength, and resources. Family homelessness was on the rise in Belknap County prior to the pandemic, a trend that continues beyond. So we saw a huge increase in need that we continue to tirelessly work toward meeting. The data in the Status of Women report reflects trends, experiences, and realities that our clients face. They are real. When you read the data in this report, you can be sure there are real people experiencing these inequities and barriers in our communities. For example, the Status of Women report reflects the trends and experiences, or excuse me, I should say, shows the majority of unhoused people in New Hampshire are men. Well, however, the majority of unhoused people with children are women. This is important context as we plan to meet the needs of our clients, our families, our women, and educate our community on those needs. We will use this data. It's valuable to us to evaluate trends in the state compared to our community, and to apply to other grants, and to effectively communicate about the need for programming that we provide to our community members, to our donors, to our policymakers, and to our grantors. So this is valuable. It's always has been, and it continues to be. We are grateful to have a tool like this to support our work. Thank you so much for having me present today.
Thank you, Paula, and thank you so much for the work that you do on behalf of Belknap House in the Lakes region. That concludes our speaking program. Thank you to all of our speakers for your work on this report and the work that you do in the community.